I don't think our HR department has been transformed. Our organization has been transformed, and I really believe that we are now a learning organization as well as a treatment agency.
With this very ambitious and wonderful mandate, which was to really kind of formalize and create a structure for helping our employees grow within the organization, something that we'd done and had been part of our history for the 40 years that the health center has been around, but this was sort of, the time was now to make it more formal, that we needed to kind of put some structure to it. So I was fortunate to be asked to be part of that process. And as with most programs, when they're starting, it's a very humbling process, because one of the things that comes through pretty quickly is how much you don't know. And it's very humbling. And so one of the things that was a realization to us very quickly was that we were a health center, and our business was to provide care for patients. And so how were we going to pull off this vision, given that our mission was slightly different? So we set out to find our educational partners, and we started this partnership with our local community college. And we found them because that's where our employees were going. So we went to them and said, how could we work together? We found JVS. And we were sort of building this partnership. We really have created a systems change within our organization where we are, as a result of this grant, more embedded into the health center and more institutionalized. And we have also, I think that's been a great accomplishment. We've been able to support systems change at our community college level. They realized they heard the employer feedback around this need for this medical interpreting certificate at the pre-college level with JVS. We were able to facilitate them wanting to go to the next level. And so, but most importantly, we were able to kind of give a voice and a forum to our frontline workers and really kind of put the spotlight on them, and that has been the most gratifying.
The idea of hybridization of online work, of tech-enhanced stuff came to be, and not only has it helped the students from Tenderloin, and I know has gotten them a better living wage and has secured their jobs, but in a sense, in our college, our community health worker certificate has been around for 17 years. And the legacy of this grant is that it's going to make it more accessible to other community health workers, other colleges as well, and other community health workers. And we're now going to be, for the first time, I think, in the beginning, we really thought that we were just doing this work for the benefit of Tenderloin Health. And it turns out that we, the college, will reap more of the rewards than Tenderloin Health. And the legacy is that those hybrid classes will really transform how we provide education, not only within the certificate program, but now maybe within the healthcare interpreter program and other certificate programs that are in the college.